in this session are really going to transition to the part of the event where we are talking more specifically about our congressional visits and getting ready for them. And then what will happen after, we will hand it over to our partners at Soapbox. They're going to go through the scheduling and hand out your schedules. So you'll see tent cards on tables. For the most part, I tried to put them where you're sitting, but if there's multiple people per state, you may have to get up and move to those tables where your tent card is. So Kevin will explain everything from there. And then after we end the day, we'll have a short break for a refresh, and then we will be all meeting in the lobby to board transportation over to the reception. So we'll remind you when we are done where to go. So for now, I'm going to hand it over to Dave. He's going to take us through a little bit more on the how to prepare and how to make the most of your visits for tomorrow.
Thank you, Jamie, and we'll team a little bit on this. I just want to observe that I thought really the storytelling exercise, which was your idea, was tremendous. It brought forth really what you want to keep in mind, I think, for the meetings, because it is the most important element that you can bring, which is your experience, how it affects your life. We'll follow up. We'll provide you with the material for the asks. You don't have to worry about becoming the policy experts in all of these areas. We've had an amazing, really, day of a lot of content. But that story is really the most important thing to focus on in these meetings, and we'll emphasize that again and again. But it was very exciting to hear that and to hear how you're bringing that to the congressional meetings tomorrow. I've been in this line of work for about 30 years, and the meetings that I remember most from that time are those that really revolved around a personal experience and how the members of Congress and their staff can make a difference. So at the outset, too, I know we have a lot of energy in the room. There's a lot of work that needs to be done. Congress needs to respond. The agencies need to respond. But as my wife frequently tells me, sugar and honey are better than vinegar, particularly in starting out and building a relationship. That doesn't mean don't be focused, don't be energetic, don't be specific. It just means we are about building relationships here that are important for making a difference in our priorities. So we all know that things are a little bit crazy in some ways, a little bit of a circus. What I'll start out talking about is really the environment that you're going into, because you're not operating in a vacuum. Congress is working on specific legislation. There are issues that they're dealing with. It's important to have a sense of what's going on around you as you go into these meetings and be able to navigate it more effectively. And there is a lot of noise. We're trying to penetrate that noise, be relevant, specific, and bring about action with our allies in Congress. And so these are some of the particular factors that I think are important around the environment that you'll be advocating in. So there's lots of new on Capitol Hill. This means primarily new members of Congress. The last election in particular in the House brought a lot of new freshmen, as we refer to them, into the House, which that change is actually an opportunity. It's an opportunity to educate people. They haven't sort of loaded up their agenda for what's important to them. They're hearing about things oftentimes for the first time. So that newness can be a real advantage as we're taking our issues forward. There are all kinds of challenges around managing the Democrats and the Republicans internally. You don't have to worry about too much of that, but it's affecting the environment. We also had a pretty slow start to the year with the government shutdown. But that's behind us. We're now really operating in the middle of the budget season. So a big part of our agenda, as we'll talk about in a couple minutes, is focused on budget decisions, allocating resources to COPD. So we're right in the middle of that activity. Things are pretty polarized and divisive. Again, it's not our problem necessarily, but it's a reality that we're dealing with. There were a couple of notes around the room. By the way, how many folks have met with members of Congress already? Okay, so the majority of you have experience with this. You're veterans with this, so you know that our issues are not partisan per se, but there are different views. So, for example, I heard mention of the fact that the member of Congress may not care about organizations like this. Well, that may be what it sounds like. Sometimes it's something like, we don't support appropriations for specific diseases. We support NIH overall. And when you hear those things, you'll process them and you'll understand where they're coming from, and importantly, you'll work to stay on message. But there are these sort of broader views of what makes sense in terms of the budget and in terms of policy that we'll be navigating through. And then a lot of our energy is already beginning to shift in Washington towards the next election. It's not really moved entirely that way. It'll be a few more months, probably get through this budget cycle, and we'll see really the attention be very much focused there, but that's always the case whenever you have a presidential election approaching. And then specifically, what is Congress focused on today? What are they acting on in committee? What are they acting on the floor of the House and the Senate? As I mentioned already, it is the budget or appropriations season. This is making decisions around 12 different appropriations bills that fund the entire federal government. We have a real emphasis in one of those bills, the Labor, Health, and Human Services appropriations that we'll talk about specifically in a minute, and that's moving. Importantly, some years that really doesn't get moving until very late in the cycle, but we're seeing early action, at least in the House, on that, and as I mentioned around the CDC priority, early positive action, which is helpful to us. The Senate is not yet really engaged as much in that appropriations or budget process, so it's very timely for us to be talking to those Senate offices about what our priorities are and putting those in focus for them as they're making those decisions. They're continuing to be wound around the axle of the nominations process for the administration, difficulty getting those folks cleared. We have, in the healthcare space in particular, a lot of emphasis on the cost of medications, on transparency around that, on the balanced billing issue, or surprise billing as it's often referred to. So there are a variety of other issues around healthcare. The ACA is pretty much off the table, as you may know now, because of the division in Congress and the fact that the House is in Democrat control. So while there's continue to be committee hearings on this, on the ACA, and focus from the administration on various things that they can do administratively, it's really not moving in Congress. And I know a lot of organizations, a lot of people that deal with healthcare issues are very concerned about this, and I wanted to give a little bit of context on this. And of course, finally, the Mueller report is always looming in the background, not something, again, that we'll have to deal with at all. You're all familiar with it, but it is a factor in the environment that we're headed into. So, your job, of course, and you have accepted it as state captains and as participants in the Impact COPD meeting, is really to bring forward those priorities. We talked a little bit earlier about building awareness. That is a fundamental goal, certainly, to define COPD, to help more policymakers and their teams understand what the disease is, what it's like to live with it. We don't have to have perfection on the statistics. It's really about helping them get a sense of what the disease is all about. And as I noted at the outset, we want to build durable relationships. This often like to refer to politics as a full contact sport. It's very hard to do it all remotely. The fact that you're here, that you're interacting with them, that you're building these relationships is absolutely critical to our policy successes. Those line items that have been created at the CDC over many years in the Chronic Disease Center like we want for COPD, that's how they were accomplished. I can assure you it was the direct contact, the advocacy, the building, champions. We like to use the term champion a lot, and what that means is a member of Congress who really buys into our agenda. And then it doesn't have to be a senior member. It doesn't have to be a member of the committee. It's more important that they're dedicated to it, that they partner with us, and they become active participants. And sometimes this doesn't happen in the first meeting, believe it or not. I know from the show of hands, of course, that you have experience, and oftentimes it's the second, third, or maybe even beyond where the conversion happens and they see an issue that they're interested in, they have an experience. It can happen quickly, but it is about both being directly engaged and being continuously engaged, and we'll provide some tips on how to do that as we move forward. Just to, together with the chaos, to indicate that there are some bright spots certainly in the congressional environment that are, I think, important. Even with the focus on gridlock and divisiveness, there are things getting done. As I mentioned, the appropriations process is underway. Decisions are being made. Key decisions for our agenda are happening now. So behind the headlines, there are always things that are getting done, and it's the organizations and advocates that stay engaged, keep moving the agenda forward, that succeed in that environment. Don't get distracted. You'll get into a meeting, you'll say where you're from, you'll tell your story, you'll give them the paperwork with the requests on them, they'll engage you, they'll want to talk about the barbecue next week, they'll want to talk about their campaign, they'll want to talk about the cousin, you have to respond to that, but very important to stay on your message. Oftentimes you only have 15 minutes, maybe 10 minutes. For this engagement, particularly in what we call member-level meetings, where a member of the House or the Senate is involved. It can go very rapidly, so you want to get right to your message, right to who you are, where you're from, your experience with COPD, and why you're here, to get their support for our agenda. So in politics, they always, when someone comes in to thinking about running for office, the first thing they teach them is you have to ask for the vote, right? You have to ask the people that you're talking to vote for you, and by extension, we have to ask them to act for us, to act on our agenda. So, Jamie, I think I'll invite you to join me in this part of the agenda. What we want to talk about now is the foundation's focus. You will have materials you'll each pick up, and we'll talk about this with Soapbox a little bit later, but importantly, you'll have one of these for each and every meeting. And it contains the basic information on the disease, those great talking points that are high level, but they really put it in perspective along with your personal story, and they include the specific requests and contact information for follow-up. So these are what we usually refer to as leave-behinds, and they're critical for your meetings and will help you make sure that the office has the information that they need. So I'll invite you to get us started on the agenda.
Okay. So the core part of the ask that we talk about is on this sheet called What is COPD? This is sort of the all-in-one. This is going to be in your leave behind folders. However, we did, despite about 5 of us looking at it, catch an error in the document. So we are re-stuffing it. We fixed it, and so the one you have does have, in the orange folders, has the error. So see if you can catch it too. But they will be just fine in the morning in white folders for you all. And like I said, Kevin's going to close this out by talking a little bit more about that, the folders and the labels and what to do with them. But this document, What is COPD, is your sort of all-in-one symptoms, a few facts about COPD in the U.S., some causes. We've talked I know there was a lot of discussion during the storytelling session about talking about the different causes of COPD. And we, point out that there are a number of different complex causes. But then at the bottom here, this is really what you want to look at. How can you help support the COPD community? So we have a version of this document that's more general all throughout the year. It could apply. But when you go on visits, you really want to talk about some time-sensitive, particular things that they can do. And so that's how we've come up with the 4 issues that you see on the document. And those are specifically grouped into appropriations and access. And that's because there's something going on in these issues right now. So as Dave mentioned, it's appropriation season, it's budget process. So for what you're asking them, how can you help support the community? It's right now, the best way is that they can make sure that the CDC is appropriated $3 million to start work on COPD, to help fix the issue we've been talking about all day. And we want to increase funding for COPD research. In this year, the coalition of organizations that we all work together on COPD issues, we came together and we agreed to specifically support this request of $25 million. It added budget for the NIH for COPD research. So this is not, we gave the NIH $2 million last year. They should have just used some of it for COPD. What we're saying is, we want you to give them an extra $25 million to work on COPD work because the science is there. If in your orange folders, there's a document, the background information document, and for each of these issues, there's some background facts and then some more talking points. And those are designed to really help get you more familiar with the issues. Not that you're going to rehash all of those at the visits. You won't have time for that, but it's for your own purpose. So spend a little time with that tonight and just get to know the issues.
Before you move on.
Yes.
We have to move on to the next set.
Yes.
All right, just one point of emphasis on these funding items. Please keep this in mind. The House, I mentioned this earlier, the House is already acting on these bills, and they've included the increase for the NIH. They've included the CDC funding. So you want to thank them and ask them to keep that in the legislation. Yes?
Will we be told specifically what bills that is in, so as we speak to them, we can reference it?
The health, just remember the Labor, Health, and Human Services Appropriations Bill. You don't need to know the number. Don't worry about the number. Just you can just say the Health Appropriations Bill, and they'll know what you're talking about.
I just want your support.
Yes, it's in the House bill. The House bill is about to be debated. It will stay in. So we're about keeping that in the process. The Senate hasn't acted yet. And so when you're in the Senate meetings, you want them to do the same thing. You want them to, they don't ever follow the House, by the way. They do their own thing. So we want them to increase the NIH, include funding for COPD. They don't, as was mentioned earlier, Congress doesn't line item the NIH budget and say specifically how much for COPD. They provide funding at the institute level and at the NIH overall level. So we want that increase for the NIH, and we want funding for COPD in the CDC budget. Now, Grace Ann?
Yeah, are we not making any ask if they are in the caucus to thank them for being
Yes.
in the COPD caucus? And if they are not, to say, please join the COPD caucus?
We will get to that, definitely, definitely. Now, The one thing you know this, but just to make sure, these are specific hard asks. And I'm not saying it's easy, but we have to be careful. Members of Congress sometimes will take the path of least resistance, not unlike other human beings. So if you give them an option that's a little easier than specific funding or specific legislation, you've kind of given them an out. Now, joining the caucus is helpful. We want them there. It'll indicate that they're committed. It'll get them into the flow of things. But we specifically want these asks to be in your meetings. And so in the Senate, just to recap, they have not begun action on their appropriations bill, and we want them to include these two items.
Does the Senate have to wait until the House, does it go from the House to the Senate? They have their own?
No, they do their own. They do their own. That's a tax bill. The Constitution says a tax bill has to start in the House, but not an appropriations
Then
bill.
it would
Yes.
House bill passed.
No, sir.
Okay, so the bill is in front of the House, it hasn't passed.
Right. It's right in front of them. I mean, it's,
Ask the congressman to vote for it.
yes, continue to support it. Our item is going to stay in. At the end of the process, they'll come back and reconcile the whole thing. It's supposed to be the individual bills one by one. It usually doesn't happen that way. They put them together as they have the health bill in the House is combined with a bunch of other bills to be considered. And that's how they're doing things. Now you might hear this term minibus or omnibus. That's when they combine the appropriations bills. But we want the House to hang tight on its priorities, and then in the final step of the process to insist on its position. We'll see what the Senate does.
Yeah, and this is the document I was referencing. This gives a background on the appropriations process, where we stand now, how does CDC get funded, how does NIH get funded. It says congressional visit background information. So spend some time with this evening, digesting that information, ask us questions at the reception, go through it. Okay. Perfect.
Okay.
Yes. I would encourage you to bring, these are the orange ones, are what we would call your participant folders. I would encourage you to bring them with you tomorrow so you can have your own set of information. You've got your own talking points with you. You can jot down your story and what you want to say. You will be coming in the morning and picking up the leave behind packages, which are the folders you're going to give to the offices. Okay. They will not be orange, they will be white. All right, we'll move on then. So the other issues that we know are urgently affecting our population we've talked about today are oxygen and the potential issue around ventilators. And we've included that because there is a time-sensitive ask in the sense that CMS has not finalized the rule. And there are, on the House side, it's not as important to stress this issue because the sign-on letter did close on Friday, unfortunately. But it is possible to make sure they're still aware of the issue and we still talk about it. So we want them, again, the ask is that we do not want CMS to include ventilators in competitive bidding. So it's phrased, exclude ventilators from competitive bidding. And if they ask you how, it's that Congress needs to pressure CMS to change their mind and not finalize that rule. Valerie. Yep. That's a ventilator issue. Yeah, exactly. There were patient and professional society comments that were submitted to CMS saying, that this was a bad idea. So we want to reinforce that because basically they're setting up the scene that CMS is still going to go ahead and do it, and we're going to have to build legislative champions to make sure that this is excluded in the future. So you're really raising awareness of the issue with them. On the Senate side, and I know it's tough when there's differences for the House and the Senate, but we have a couple of those instances this time. On the Senate side, there is a sign-on letter about to be released. So a sign-on letter is when two members of Congress agree to lead a letter to another federal agency saying, we urge you to do X, Y, and Z, in this case, to reconsider your decision to include competitive ventilators in competitive bidding. Then they send out a Dear Colleague letter to all of the other senators and say, will you join this letter? And the offices say yes or no, and then they send one letter to CMS with a number of different signatures. So in the Senate, that letter should be out in the next week or so, and so you can alert them that that's going on, and that you hope they will consider joining the sign-on letter when it's released.
Sammy, who was the two people that started the sign-on letter on the Senate?
Right now, it is Cassidy, and then they are working on finalizing the other. And then, as you know, we are in a little bit of a pause as it relates to the oxygen issue, but the most time-sensitive thing to stress is that we need to keep the pressure on CMS to be monitoring the issue, especially as it relates to liquid oxygen in the gap period. Again, a similar issue in the sense that we are building awareness of the issue and starting to lay the groundwork for potential need for legislation to fix it in the future. So we have two very specific asks and two asks that are critical access issues for our population that maybe they don't have on the House side an action they can take tomorrow, but there might be down the road in the near future, and we need to really talk about the issue more as you have the opportunity to. And then we would say, please join the caucus if they aren't already caucus members, and Kevin will show you where to find that information. Anything else we're missing?
Questions on the policy agenda, these items? Yes, sir.
I really am concerned that I don't have enough power to defend either item at the bottom. I'm really concerned that I don't understand enough about those issues. I'm not saying they're not important. I'm not saying there shouldn't be back, but I'm not sure if somebody said to me, no, that's not accurate, what my response would be.
Well,
The first, they're complex issues, for sure, even if you've been working on them a lot. So I think it's best to put it in the context of your own experience. If you're a patient or if you're a provider, what these strategies, what these technologies mean for quality care, for good outcomes. And if you talk about that, I think it'll help them understand why it's important to preserve this coverage in Medicare. If you get into an argument around sort of surrounding issues and other, I would have tried to avoid that and just bring yourself back to how these technologies make a difference for patients with COPD. Okay.
yep.
Thank you.
You're welcome. Yes, ma'am.
To reference, as a respiratory therapist, if you have access to the AARC, both of those access to cares are very prominently written out as to what they are
Yep.
and the ask, because the AARC has been asking respiratory therapists to put that out there. So if, as a respiratory therapist, it is up on their, when you open up their website, you don't even have to log in. I'm sorry, the AARC right on their face page, on their web page, has both of the access to care very detailed as to what the issue is, what the asks are, and which representatives or senators are participating in this process. So that may be of assistance. You don't even have to log in.
What's the
with
website?
It's the AARC.org.
.org.
And,
Yeah.
then and as it relates to oxygen data on this congressional background document, there's a number of different data points. You can learn more about how oxygen access has changed over time. And again, you aren't expected to be a technical expert on the issue. You're there talking about the access challenges that are facing COPD patients. You may have a personal passion that you want to talk about, as well. And I encourage you to talk through those things with us over the next in the evening and in the morning, so we can help you and figure out how to integrate that. If there's something else you want to talk about.
Can you give them 2 sentences on why people need liquid oxygen?
Sure. Go for it. Sorry, I'm getting.
Jamie, I think there's some sense of discomfort on the access to quality care issues, and it might be better to have that in a leave behind package rather than have the state captain or advocate completely botch the issue. So I think you can say there are oxygen issues that you can read more about in the package. 1.5 million people in this country are on oxygen, and we are concerned about ventilators and Medicare, and leave it at that, and not try to go beyond the knowledge depth.
It's important not to do that because you don't want to get in a situation where you're beyond what you're familiar with, and you should resist that. So we will have, the material will include detail and also contacts for follow-up. That's the other thing. You should feel very comfortable with saying, we will be back in touch with you with more detail. If you've ever gone to a congressional hearing, that's the best thing to have a witness trained to say when they get into territory that's beyond their knowledge, is not to wing it, but to say, we will get that information for you and get back to you. And so you'll follow up with Jamie, and we'll supply that after the meetings. Yes, ma'am.
I think, as Grace Ann and you have just pointed out, that it's really important that everyone feel really solid and comfortable about what they're going to talk about. And remember, whatever you might have missed stating in your meeting, as long as you left a good, big first impression, you can follow up with emails, you can follow up with hard copy letters, and you can say, would you like me to reach back out to you, or would you like my organization, the COPD Foundation, to reach back out to you? And we will definitely give you all the information you need to make an informed choice.
It's a very good point. Your main purpose there, is as advocates, is to tell your story and get in front of them, and then the materials will kind of do some of the talking for you in the sense of giving them the exact ask that we're talking about and our information for follow up.
Right. You'll see a look of relief come over most staff's face when you're done saying who you are, what your experience is, why this is important, and here on this sheet are our priorities that we're advocating for, so that they know you've got the content, you've got a team backing you up on any specific questions they might have, and it really comes across powerfully. Any more questions on the content? All right. We've already been over this, but just to bring it home again, you will be a constituent in most of these meetings. They need to know that. They need to know where you're from. That is, as you've heard repeatedly, the most important connection, and you know it. And that is the ultimate tool in the toolkit for having an impact. So I'm going to use the term champion in another context here around advocacy itself and some of the tips, many of which have already been touched upon in our exchanges, but it is something that needs to be regular. You build really relationships not with a single contact a year, but by being in touch and becoming a trusted resource, the give and take that goes along with that. The staff, it's true, they're oftentimes very young, but they have a lot of responsibility. They go on to other roles oftentimes and can become part of an advocacy network for us. So very important to make those connections and to cultivate them. The point I made earlier about don't be disappointed if you don't get an immediate yes. Oftentimes, staff is trained. I remember I went to work on the Appropriations Committee, and the clerk of the subcommittee that I worked on brought me into his office. The clerk was the head staff person, and he said, I have a very simple training process. And I said, oh, okay, what's that? And he said, learn how to say no. And he meant don't immediately say yes. Ultimately, we got to yes on a lot of things, but many of them are trained to listen, not to give an immediate yes or no on something. They need to evaluate that, particularly staff members, of course, can make more immediate decisions, but oftentimes they too, if they're new to the issue, will want some time to think about it before they act. Imagine that, thinking before you act. And then just to continue some tips here on your meetings, they happen very quickly. If it's a new interaction, you'll want to get their business card. Many staff are trained to do that really right away so that they too want to create this relationship with you. But get that card. We'll be able to use it in building our network together over time and on building the relationship. Send a follow-up. So you'll have their email address on there. Pretty quickly after the meeting, I think you want to reach out to them just to thank them for their time and begin that dialogue. It's not going to be every day, it's not going to be every week, but that way you'll have established an email contact, which is how, of course, most of them communicate these days. And you want to acknowledge and thank them, and again, offer the resources for follow-up on any questions they might have about our agenda. Other tips, Jamie?
You covered it.
Okay.
If you have a card, you leave the card with them.
Yes. Thank you, Barbara. If you have a card as well, you'll want to share that with them. I like to also, in the leave behind materials, write my name on that material and telephone number and email address. So you might do that in your leave behind packets for each of the meetings. If you don't have a business card to tuck in there, go ahead and write your name, email address, and telephone number on there so that they'll have that. They usually have a big stack on the corner of their desk. They meet. Most of you have been through this process, but those who haven't, these folks are meeting all day long. It's a very busy time of the year. They're having half-an-hour meetings pretty much all day, except when they're off dealing with committee or some other duty. So it's a very short amount of time. You want to make impact and make the relationship start. So that's what we're about tomorrow.
Oh, I know. Take pictures. They never hesitate to ask for a picture, even if it's with a staff member. You want to get a picture so that you will be able to upload that to the mobile tool, post on social media. On your tables, you had a social media guide suggestions if you have not familiar with using Facebook, but you are willing to, or Twitter with the hashtag #ImpactCOPD. So don't hesitate to take pictures, even if it's with a staff member, but definitely if you're meeting with a member.
Jamie, on the pictures, usually when I see other people's pictures, it's outside the office with the placard announcing whose office it is. That's somewhat important. Otherwise, you post it on social media, it's just a picture of a bunch of people.
Yeah, you can do it a few ways. I mean, especially if it's with a member, it's a little different. But you can let them know who you're meeting with in what you post with the picture. But most of the time they'll direct you out to the hallway to get a picture with the plaque.
Yeah, and a lot of times they like to have you take a picture in front of their state flag and
Right. Yeah, it's very common for the office to have that as part of the routine for the meeting. At the end of the meeting is to have that picture. Sometimes you get out on the Capitol steps. I think you may be referring to if you go over to meet in the Capitol or something, they'll take you out on the steps from time to time. But